This is the Amy Edwards Show.
When I looked at it underneath an ultrasound, it looked like a dog was chewing on my bone, essentially. That's what the steroids actually do. They are actually toxic to cartilage, tissue, and bone, ultimately. And so when you do high concentrations, which is what was done in my shoulder joint, it just ate away at the joint. So even though it gave me a little bit of temporary relief, it never fixed the problem. If you've been on steroids for a little bit more of a chronic period of time, that's when you start seeing a lot of that. It can impair your blood sugars, which they tell you, but even then, it's just the research that's come out over, for a good period of time that it does show that there's destruction and damage to things. And so if you want to accelerate, for instance, like a knee replacement, when you just keep injecting steroids into it, it'll start breaking down everything. You'll get to that knee replacement really fast.
Hello, and welcome to the show. Y'all, I'm so excited to introduce you today to Fawad Mian. He is Dr. Fawad Mian, pardon me, of course, because he is a board-certified neurologist, pain specialist, and the author of Getting Pain-Free, How to Get Out of Hurting Without Drugs or Surgery. That sounds excellent. And even without injections and steroids and all sorts of other things. So we're going to talk about all that today. Dr. Mian is respected as a specialist treating medical conditions such as sleep disorders, headaches, seizures, memory deficiency, sleep apnea, chronic pain, tremors, dizziness, and more, with a very solution-oriented versus symptom-oriented approach. And after facing his own debilitating injuries, he went on a journey to heal himself without resorting to surgery and learned so much that he's able to share now through his clinic, Prolotherapy Healing. I hope I'm saying that right. He uses regenerative medicine and cutting-edge therapy to help people get out of pain and reclaim their lives naturally, with a mission to show you that pain doesn't have to be permanent. How wonderful is that to hear? And that we can all heal without becoming dependent on drugs or going under the knife. So he talks about PRP and mind-body integration and so much more, blending science and soul to help people get back to living fully. You're based in New Jersey and was named a top doctor for 3 years running. And I am so excited to welcome you today and jump into your story, which I haven't read your whole book, but I read some excerpts, and it was super fascinating to hear your journey with chronic pain. And it dispelled myths. Just in the little bit I read, it was already dispelling myths about steroids, about rest versus motion and movement. And so let's dive into your story and how it's fed your journey. So welcome today.
Well, thank you for having me on the show. Appreciate it.
Yeah. Well, this is such a big topic for so many people, especially getting older. I'm in my 50s. And as we age, just out of the blue, we can be hit with pain that we don't anticipate. And so we don't know where to turn. So how old were you when you started experiencing pain? I know you had some shoulder pain that you injured just in a heartbeat, right?
Yeah, I mean, for me, it was my, say my late 30s.
Yeah.
A little bit older too, myself. But, so in my late 30s, and, the first thing that I noticed actually was I was at the gym and, lifting weights. It was a lot of weight, and I was doing some shoulder shrugs at the gym, and I just let the weight slip like that. And that's actually when I started getting the shoulder pain. I was like, oh my God, I don't know if I'm going to be able to continue my workout, but it was really sharp, really nagging, really hurt. And so, I did the natural thing that most people would do, and I would go to the orthopedic surgeon because that's what you do.
Yeah, that's what you
hurt your
do.
shoulder, you go to see the orthopedic surgeon. So one of the first things the orthopedic surgeon says to me is like, well, hopefully we can get a surgery out of you. Maybe there's a tear in there that we can try to repair. At that point, I'm already a little bit at unease because, I've been through surgeries in the past for other things, and I've had my fair share of that. And, I did some x-rays. Make a long story short, the PA did some steroid injections in my shoulder. And what I actually did was actually accelerate destruction of the joint even more. Even though I felt better temporarily, what happened was I was still in pain. I couldn't lay on my side. I couldn't sleep. I couldn't put my arm above my head. Couldn't put it behind my back. Couldn't do any of that stuff.
Wow.
I couldn't lift weights because I still like lifting weights and being healthy and all of that. And I couldn't do that. Then at the same time, what started happening was all of a sudden my foot started hurting. Just one day, I had been in New York for a while and was in Atlanta for a little bit, and then I was back in the New Jersey area. One day I just started walking and I was like, wow, why did I feel a sharp pain in my foot? Where did this
Oh
come
my
from?
God. I can so relate to this.
Yeah.
Yes.
I was like, this is so random. I'm still in my 30s. Why is this stuff starting to hurt? And I thought it would go away. I could walk it off, but it didn't go away. It was really sharp, debilitating. I was limping around. So then I did what everybody else would do. I went to the foot doctor, right? Because that's what you do. Foot doctor takes some X-rays and says, okay, maybe you have a little bit of plantar fasciitis, which is irritation of some of the tissue on the bottom of the foot. Common thing to see. So he gave me some orthotics, which I had to purchase, obviously. And as as pricey as they were, I thought at least they would do something, and they didn't really do anything. They just caused more pain. They were very uncomfortable to use. I started to use Frankenstein shoes, these big platform-looking kind of shoes. I mean, they weren't stylish back then. And so I started wearing these, and it was miserable. We were out in New York one time with family and my wife, and they're like, "Why are you walking like an old man? You're like in your 30s. Like, what's going on over here?" And I was completely miserable. If that wasn't enough, then my left knee started hurting.
Well, because 'cause you're compensating, right? Like, you're compensating for your foot. Yes, I can relate.
Yeah, I know. I'm falling apart, and I'm not even 40 yet at this point. So I was like, okay, this is a little early, and I felt indestructible a couple of years ago. Didn't feel like anything could touch me, but I'd actually had torn my ACL, which is one of the ligaments in the knee on my left side when I was in school a long time ago, and I had it surgically repaired. But now all of a sudden, this is like the first set of pain I had in my knee for like a good while. So I'm walking like I'm 90 at this point, unfortunately, and I'm figuring out, well, what do I need to do with this? I went to another orthopedic surgeon who barely looked at me and essentially barely touched my leg and says, maybe we should scope your knee. I'm like, really? That's not exactly what I wanted to do.
Yeah.
Ultimately, I had a friend of mine write an MRI script for me and found that the ACL that was there was theoretically surgically repaired. That no longer was in existence. The whole thing was torn. So maybe the graft actually never really worked in the first place. And I had some swelling in my knee too as well. But I had a lot of scar tissue, which seems to be holding my knee together. So thank God, at least I had that. That was the unanticipated consequence of that. But ultimately, so I had like three things that were
Mhm.
going on at this point. And so at each stop, it ended up being a surgical procedure for me. Or I take some narcotic medications, which can sedate me, which would not allow me to mentally be at my best as I'm treating people ultimately. And it's a miserable thing to take pain medications all the time. That's not something that I want to do, even with the folks that come into my office, whether or not they be doctors, lawyers, law enforcement, or other things where they really need to be cognizant and aware of what's happening. It's the last thing you want to be on ultimately. And so, my Achilles started bothering me afterwards after I gotten some steroid injections in my foot. So I'm kind of segueing back to that here in just a little bit. And I'm going to kind of bring the
Sure.
whole thing around here a little bit. Um, and so I still was in misery, still walking around Frankenstein shoes. And then the foot doctor was like, well,
How long is this going on, by the way? Is this, like, 2 years or
this is like a good 2 years. I mean, like I really fell apart in
it's
two
crazy?
years. Um,
Gosh.
I'm just like, I'm like thoroughly amazed actually, even thinking about this and talking through it. I'm like, this is a lot to be like a
Yeah.
short period of time. And then the foot doctor eventually was okay. My Achilles had started bothering me, and that was actually the worst part of it. So after I had steroid
Wow.
injections, I actually went running, which you would think, hey, steroids are going to cure everything. They don't ultimately. And so
Yeah, I wanna talk about that.
yeah, yeah. So with my Achilles at that point, the surgeon told me, look, it's not getting any better. We tried all these treatments. We're probably gonna have to shave down the bone or maybe take it off, shave the bone, reattach the Achilles.
Oh
Uh,
my god, that sounds so dramatic. Oh my
yeah, and I was
god.
just like, okay, this is like enough. I've had enough. I can't do this anymore. There's got to be a better way of treating this. And that's when I thought, well, I got to find something else. So back around in 2011, 2012, the amount of resources that were there at the time, are not there as it is. So as it is now, I should say. So I was looking into other alternatives, and I came across prolotherapy, and I went to a conference in Denver to learn more about it. And the idea behind these injections were to inject a solution, a sugar-based solution, which was very simple, which apparently this is something that actually was utilized for a long period of time, but then just kind of fell out of favor for steroids and other things over time. And I did, and I actually had a treatment in my Achilles, and noticed I felt better at that time, and I was training and learning about it too as well. So then to make a long story short, ultimately, I had looked into other things too as well, such as platelet-rich plasma, where we essentially take your blood, we concentrate the growth factors in it, and then we inject it back in, ideally using guidance. That's what we do nowadays. And that was able to get rid of my plantar fasciitis after one or two treatments with that, about two treatments with that one. The Achilles was really nagging, and actually I had to do a lot of injections for that because it kind of spiraled out of control. But I had several treatments of PRP for that ultimately, and nobody had to shave my bone down or cut open into me or anything like that. I had to do a lot of self treatments for that too as well. I also did some prolotherapy of my shoulder one day.
And it regenerated? Like
It got better. Actually, I could see
it healed itself? Like it started?
yeah. So actually the tissue looked better.
Yeah.
So actually when you put it in the injector, you can see under an ultrasound what it looks like. And you can see how well integrated the tissue is, without getting too much of the nerdy science, all of this. But it was
No,
amazing
please
how much,
do. I'm here for it. Get nerdy. It's okay.
yeah. So, the growth factors help stimulate healing, basically tell other cells to come to the area and start healing the area, essentially. And so, whereas the tissue looked more like moths were eating at it, it looked more uniform. That's what we look at when we look under the ultrasound. And so, even though I may have a little bit of a bony overgrowth on my Achilles, I can run, I can walk. I don't need Frankenstein shoes anymore, thank God. Um, and then, in terms of my shoulder, which was one of the first things that started bothering, one day I did some prolotherapy on it to begin with. It took a couple of treatments of PRP and prolotherapy to undo what the steroids had done, because when I looked at it underneath an ultrasound, it looked like a dog was chewing on my bone, essentially. That's what the
Wow.
steroids actually do. They are actually toxic to cartilage, tissue, and bone ultimately. And so when you do high concentrations, which is what was done in my shoulder joint, it just ate away at the joint. So even though it gave me a little bit of temporary relief, it never fixed the problem. I had to try to repair the ligaments that actually held the bone together over here. So now I'm able to put my arm above my head. I can throw stuff. I can sleep on my shoulder. I can put my arm behind my back. And so it made a world of difference. And as time went along, I started getting more and more training as the years went on. This was before even, PRP is a little bit more of a household word now. Back then it wasn't. A lot of people didn't know what it was. It was just kind of in the periphery. So I had done a lot of training, started using ultrasound guidance years ago too as well, to really make sure that we're injecting it into the right areas. And so ultimately I started implementing this with my patients too as well. And we found that a lot of these patients who are told that they need surgeries or pain meds were the only answer, well, it wasn't the only answer. We really get some patients back where, hey, they didn't have to do surgery, no matter how bad their shoulder looked or how bad their spine was or how bad their knee was too, ultimately. And I believed in this and so much to this extent that I actually ended up treating a lot of family members, from my father, and I seriously did my father-in-law, hit him a few times. I had to fix my wife's hip, her knees, and she's younger. She fell off a horse about a month or two ago. And so we're trying to fix that, and she's significantly better with that. And even my own mother, hey, she had bad plantar fasciitis, and I've been nagging her for a good while. Then she's like, I don't know what you did in there, but it feels like it hasn't like in years. That was just
Wow.
one treatment with her, and she's skeptical about literally everything, as most mothers would be. And so, we were really amazed at just how well it could, how well it works on people and how well it works on family members who are very skeptical to begin with too as well. And so I find that, adding in autologous stem cell therapies too as well, along with PRP, prolotherapy, has made a huge difference with a lot of our patients, specifically meaning, these patients were coming in for quote unquote neurological issues, because that's part of what I do.
Mhm.
But really, ultimately, it came down to unstable joints, unstable areas in the spine that really needed to be treated. Because part of what also this is trying to create something that has greater stability. The word for that is called biotensegrity. So when you put the tissues, basically just keeping the tissues together so there's less irritation and movement of things. You think about the spine, say, for instance, when it starts breaking down, it's not just the disc that's kind of jutting out. You said people say I have sciatica disc herniation or whatnot. Well, it took injury and damage to the joints and the ligaments surrounding all of that for that to even happen. So we're trying to stabilize all of that in the spine, say, for instance, also the knee and also other areas too as well. And so that's probably a little bit of a difference that I do compared to some of the people who do it as well. But
I
I've
mean,
been really
it's all connected, and it's so I think that's just how it should be because they do all affect each other. This it's not isolated and just happening in one, spot.
right, yeah. And so,
Yeah.
for me, for us, I mean, this has been huge, and we continue to do it in our office because I believe so strongly in it. I think the other part of this that often gets missed is that it's not just the injections itself to try to help overcome the issue. It's also I always try to hit on the fact that look, we need to take care of the rest of ourselves. And so a lot of this is going to be, okay, what are you consuming? What medications are you on? Are you taking any supplements? Are you getting your sleep? Are you getting exercise? I mean, exercise is really should be something that's important to everybody because your cells will be happy and the rest of your body will be happy if you're doing that too as well. And so we try to put the whole package together with people.
When you were going to doctors and getting steroid shots, and you are a doctor, so, like, do these doctors know the degenerativeness of these steroid shots? Like, what is gonna happen, and they're doing it anyway?
I don't really think so.
Oh, really? They don't even know. They haven't even I mean, it just seems like if they're giving those shots, they should know what the implications are down the road.
Well, we do know that, there it can have some side effects here and there, but people sometimes will say, okay, we'll get steroids and you're going to gain some weight. I mean, usually,
Mhm.
a steroid shot by itself is not going to make people, if you've been on steroids for a little bit more of a chronic period of time, that's when you start seeing a lot of that. It can impair your blood sugars, which they tell you, but even then, it's just the research that's come out over, for a good period of time that it does show that there's destruction and damage to things. And so, if you want to accelerate, for instance, like a knee replacement, and you just keep injecting steroids into it, it'll start breaking down everything. You'll get to that knee replacement really fast, but you don't want to get there
Wow.
when you're younger because you can still have pain when you have a surgery. It's like I had my ACL repair. I've had surgery to my jaw for an overbite a long time ago. Just because you have surgery for something doesn't mean that things are going to be necessarily okay down the line. You can still have issues ultimately too as well. And so if you can do something where you're proactive or where you can preserve things earlier on, the better off you're going to be ultimately.
Yeah, for sure, for sure. And, oh god, I had another question during your whole journey, and I forgot what it is. I can really relate to a lot of this. I had a massive surgery and injury. I smashed my tibial plateau and tore my ACL in 2006. And so I had a pretty dramatic surgery, right, with a
Right.
plate and pins and all that. But in the last 20 years, 19 years, I've, compensated for it in a lot of ways that so now I can feel it in my back, I can feel it in my left hip, I can feel it in my feet. And it's just, it's a whole process when you've got something going on in your body and the implications like you experienced that you can deal with. And I know that movement and exercise are all such a component of that. Um, I found it very interesting that you talk about rest not being the best road to recovery and movement versus movement. And how would that apply when someone's in pain? Because that's hard to do, you know?
Mhm. Yeah, I mean, with this, so initially, if I did treat somebody, say, hypothetically saying here, um,
Mhm.
typically we'll tell them take a little bit of rest for a couple of days. That's just so things could set in. It depending on what we treat, maybe we might have them non-weight bearing or they have a brace to keep things together. But then, roughly after about 4 days or so, we want them to start moving around, even though it may be a bit achy at that time because you got to restore some of that movement. The thing is, for instance, you like when you if you ever broke anything or whatnot, you'll be like in a cast, and when you take that cast off after 6 weeks, lo and behold, all the muscles have atrophied. The movement of your joints just are not quite the same. It takes a lot of intensive rehab. Tissues ultimately surrounding all of that are going to be at a greater risk of injury ultimately too as well. So we want to try to preserve
Yeah.
things as much as possible. So then, we try to get people to move like a little bit with a bit of time. A lot of times we may integrate supplements too as well they're anti-inflammatory. And obviously, before anybody does anything with supplements, you should definitely make sure that it is appropriate for you and that you're not anything that would counteract or interact with any of those things. But sometimes anti-inflammatory supplements and anti-inflammatory diet can start dampening some of that pain down while you're starting to heal ultimately. And then we
Yeah.
start integrating that with some, PT and movement or maybe functional movement to try to start working on that.
And this means like long-term healing, right? Like it's not like you with your own pain, say in your shoulder, that you keep doing injections, PRP, things like that with it? Or is it just like it is our bodies have the power to heal and you're able to heal?
Yeah, I mean, and so that, the bodies do have the capacity to heal. After I'd done that initial round years ago, a couple of years back, I was like, cool, did I do something to that? And then it just dawned on me. I actually realized just from the nerdiness of what I do, there actually were some ligaments that I didn't bother doing. And I only realized it until I'm like, oh, okay, I missed those. And that's exactly where it was. So
Wow.
I went in once and that was the end of it. Now I'm fine. I don't have any issues. Just like just overlooked that years ago. But for a lot of people, they can have long lasting relief, being pain free, or at least for some people, or some people are so degenerated over time, if we're even able to give them 60, 70, 80% back compared to where they were, that can be huge for them if they were living chronic pain and they just couldn't move at all. And so for a lot of people, it can be very long lasting and eliminating pain altogether too as well.
Wow, that's so cool. I mean, I live with a former pro athlete and he has had one shoulder surgery.
Hmm.
He needs another, and
Right.
he's in constant pain
Yeah.
with it. And so this is really enlightening because he's done stem cells and some other things. I don't know what prolotherapy is. I've never even heard of that until you. What can you explain that?
Yeah. So prolotherapy. So I kind of look at this as more of like a spectrum. I kind of look at it as there's prolotherapy, there's PRP, there's stem cells. And there are a couple of different types of stem cells too as well. But
Hmm.
prolotherapy is the most basic level, where it probably has it has less of an impact than PRP and stem cells. But all it is injecting an irritant such as a sugar, dextrose in this case,
Oh,
and then
what you
actually
mentioned earlier.
stimulates
Okay.
the healing. Whereas
Okay.
PRP has its growth factors and stem cells also has growth factors, but it orchestrates a lot more. And sometimes the stem cells that are used can actually act as a graft depending on, what the area of injury is too as well.
Oh, wow. Okay. That makes total sense. And you mentioned that earlier. So got it. You talk a lot about pain and your nervous system and how connected they are. Can you speak to that, please?
Right. So, the thing with this is that, when we have pain, there are lots of tiny little nerve endings in our skin or muscle. They obviously come out from our spine and they go everywhere, just like electric cables. And so, when you have this pain that's kind of nagging, um, obviously you're not going to feel at your best. And I think ultimately it can lead to what I call more of a kindling. So, meaning if you have an injury in one place, then what ultimately happens is now they start cross talking and communicating with other areas too as well. So you might feel more of a generalized pain, where you might start feeling things where like, okay, it wasn't bothering me there before, but now it's bothering me there now. Some of that also can be abnormal compensation patterns too as well. But it just leads to not feeling as well. It leads to more of a chronic inflammatory state too as well. So then
Mm,
everything really starts feeling kind of achy. You just do not feel well. Moreover, you also start having more, I would say, more mental issues too as well, right? Because if you're in constant chronic pain, you view the whole world in a lens where it's negative. Like, okay, I'm in pain. I really don't want to talk a whole lot. I'm being short with people. If I was working and doing things, then you can't put your best foot forward for something like that, and has a great impact on all of that
mm-mm.
ultimately.
Yeah, it really truly does. I mean, that's incredible. I studied acting for a while, and I remember there was someone doing a scene once, and they were supposed to be injured, and the director was like, "When you're in pain, it affects everything you do," and it just made me think so much. It gave me more compassion for people when they are in pain because it really affects your whole life. I mean, and, like, as you know, I mean, you were walking around like you were 90 when you're 38 years old, so, yeah. How does being a neurologist really, feed your, passion around this and your work around this? Do you think it gives you a different perspective than so many other types of medical doctors?
Yeah, absolutely. Because, if you think about some of the most common things we see that in a neurology office on the outpatient side, it's going to be headaches. My back
Mhm.
hurts, my neck hurts, something is numb and tingling, or something is burning. And there are other things too as well that are more highly focused on that. But the other ones I mentioned, those are by far the most common things that end up coming into the office. And so when you're able to look at things from a neurological lens and then look at it from a musculoskeletal lens too as well, I think it allows us to be more comprehensive with things ultimately. Even with, say for headaches, just for example, I always say, hey, the head is actually the victim in all of this. It didn't do anything. It's just everything else that's going on, whether it's your hormones, your sleep, the things that you're eating, chronic neck injuries, your posture while you're at work, while you're on your
Oh,
computer.
shit.
There's
Yes.
so
Oh
many
my
things
god.
there's so
Sitting up
many things
straighter.
that go into it, yeah. Yeah, I think
Yeah. Oh, the head is the victim.
Uh-huh.
That's interesting. Yeah. What surprises you a lot? What stories from patients can you share where you're just like kind of blown away by the power of regenerative medicine?
Mhm. Yeah, I mean, there's a couple that I can think of, one of which actually was somebody who actually did, like, a lot of heavy labor and construction, and so, I took a look at his shoulder MRI, and I was like, "Wow, it's really, really beat up." And I told him, "Look, I don't know if we'll ever get you back to 100%, but look, if we can get you back, as I mentioned before, maybe we can get you back 60, 70%. Would that be good enough if we did something like this?" He's like, "Yeah, sure, man, that would sound great." And so just after one treatment, he was 90% better.
Wow.
And I was just like, wow, because I was thinking to myself, this is going to be really hard to help overcome this. But he was like 90% better. He was extremely happy. He was able to go back to his job and still did construction. Although obviously, he started having issues in his other shoulder because that was inevitable, and we had to treat that too as well. But that was pretty big for somebody like that who really has to rely on their hands, their arms to do everything. That was one story. Another story actually was actually more nerve related. I had this one gentleman who came to me and he actually had a knee replacement. So there goes that surgery again. I was like, he's having the issues with his foot. He didn't have any motor control. His foot was dropping. He didn't have control over it. He's like, I couldn't work out. I'm gaining weight. I feel miserable. And, this guy, very nice guy. Initially a very thorn in my side in the beginning, but, a very nice guy. We're very persistent. And I was like, so he just told me to look at his nerves actually, because this is something that we also do. And so I used the ultrasound. I looked in the back of his knee and, the different nerves that are running down. And part of one of the major nerves of the sciatic nerve comes down, it kind of branches off. I just noticed that it was huge back there. I'm like thinking to myself, why is this so big? Like, what happened back there that caused this? And so we actually did a treatment under ultrasound guidance to help free up that nerve and help decrease the inflammation ultimately. And then within a matter of weeks, he was able to lift up his foot. He was actually able to walk around better. He started working out within a matter of like a month or two. So here's a guy who was like miserable for 2 years, and then within a month is now back to doing stuff he couldn't do for a few years. I was blown away by that. I was like, that's amazing. I
I bet
wasn't
his
sure.
mind was blown by that. Was his
Yeah.
mind blown by that? Was he just like, "Holy crap, you're a miracle worker"?
Yeah, he did
I
that, and he
mean,
actually did a little shimmy, a little dance for me, and I was like, "All right, that's to prove that his foot would work."
you're like, "You were a pain in the ass at first, but now I love you."
Yeah.
Yeah, well, so, okay, I'm sitting here like, "How can I get to New Jersey? I wanna go and, go to see you," but, like, so what do you tell somebody like me or my partner even who's, dealing with his shoulder? Like, what if somebody's just at home and can't get to you? What do you tell them to do, or where would they start?
Well, I mean, one of the first things I would say, you're in Texas, right?
Yeah.
Right. So there's in Texas, there are actually still a lot of practitioners in that area. Depending, I would say Texas is a giant, very big state. But there are actually regenerative providers within the state of Texas.
Mhm.
But so certainly seeing somebody that's closer by can be like a good start with everything. Things that should be evaluated is how well is somebody moving? What's their daily life like? What kind of physical activities are they doing? How does that play into all of this? What are their goals in terms of, where they want to be ultimately with everything? And then even then, even if somebody wasn't going to get injections or anything like that, sometimes, quite frankly, dietary changes and supplements can make a huge difference in somebody too as well. So much so to the point that I've had patients where, okay, we're going to, for instance, for example, we'll get you off dairy and gluten, which is probably the two most common things most people would know about, and then put them on some supplements to help them with their gut lining and some other ones to help diminish inflammation. They come back in a few months, they're like, all right, I feel pretty good.
Yeah,
I feel great.
anti-inflammatory for sure. I saw a reel that you shared where you were talking about 3 different supplements for pain. It was turmeric and fish oil, which turmeric, of course, anti-inflammatory.
Uh-huh.
So I knew about those, but you mentioned magnesium for pain. I thought that was really interesting.
Yeah, I mean, and magnesium is involved in over 300 enzymatic reactions in the body. We use it for so many different reasons, and there are different preparations that are there
Hmm.
too as well. For instance, I'll use it for migraines a lot because it works pretty well for a lot of people with migraines, or at least as
Nice.
an adjunctive. But magnesium also has the effect of relaxing your muscles and mitigating your pain. And so if you complemented that along with things such as turmeric and fish oil, as you mentioned, it's kind of like, well, you have a natural muscle relaxant, and now you have a natural anti-inflammatory going on at the same time, and also dampens a lot of that chronic inflammation that's going on. So it kind of takes away that kindling I was kind of talking about before earlier. So people just ultimately feel less achy. They feel a lot better now if they can just modify their lifestyle a little bit and what they're eating and other things and their functional movement. They can make a lot of headway with just doing those kinds of things. And maybe they may not necessarily need to even have injections ultimately.
Awesome. Do you think there's a movement with doctors nowadays toward, more not just treating the symptom and more solution based and more like root cause based these days? Do you think there's a movement toward that?
There definitely is. And definitely, if you look on Instagram, there sure is.
Yeah, right. Or my algorithm anyway. Yeah.
Yeah, yeah. I mean, there is a lot that's out there. I mean, even then, you have like a functional medicine movement, which is getting
Mhm.
bigger and bigger, and I think it's now more people aware of it. Where years ago, people were not even aware of those things, and
Yeah.
I think that's been quite helpful. I think for folks like us, we're really trying to put all that together with the functional medicine, with the regenerative therapies, the other things that are down the pipeline that we're also adding into as well. I think there is a movement for that. I think there is a lot of ultimately resistance in terms of society in general, the way things are in the medical profession, because there's still things that are tried and true that a lot of people want to do. And then with insurance companies controlling things as much as they are, it makes it really hard sometimes to do things because some of these things obviously are not going to be covered by insurance ultimately. But what do they cover? They cover the steroid injections that ultimately would lead to a surgery, which ends up costing more to the insurance company and the hospitals. But that seems to be, things that are covered, or narcotics, which were, really in the news a lot in the last few years. And,
Yeah.
it's not something that you want to be on, but we're trying to overcome that with doctors in there. But sometimes it can be really slow going, especially when, people ultimately are set in their ways.
Yeah, definitely an uphill battle that doesn't make sense, and it's just frustrating for everyone except the insurance companies, I suppose. But it doesn't make sense like as a model for them to me either. But what do I know? It's complicated, right? And so anyway, it looks like positive progress though, and that feels really good. So for you personally now, what are some of your non-negotiables for your own physical and mental health every day? Like, do you have some things that you are like, this is what I do?
Hmm. Yeah, I mean, for me, it's a lot. It's
Oh, good. I love a lot. Tell me.
well, one of the first things is like is sleep. I need to sleep.
I am like, that is the key to life, like sleep.
You
Yes.
need to sleep. Look, I mean, even then, sleep is one of my subspecialties I had years ago. The thing is you can't, like, we're in a 24/7 society at this point. So really, we got to put away the screens, the TVs, the phones, and get to sleep at a reasonable time. And I'm always on my kids. Come on, let's go to bed. You got to go to bed. Also, I want to sleep too as well. But if you don't sleep well, you don't feel good, and the rest of your body is just gonna hurt, and you won't remember what you had for breakfast or where your keys are or what you're doing at work. Ultimately, that's really important ultimately. Plus, a lot of our hormones are kind of running around that time too as well, based on our circadian rhythm. So it's really important that you get quality sleep. For me, number two is really to the point where sugar is at its absolute minimal. It's really just maybe hidden in something, maybe that I consume. But, there was a time where I'd gotten off sugar in my coffee and I put it back and I just hated it. And now I'm back to drinking it the way that it is. I'm fine with it. I love it. I drink my coffee in the morning. There's nothing wrong with that. I just can't do all the syrups and the sugars and as the big coffee shops that are there that put all this stuff in there that make it have 5,000 calories.
Yeah.
Staying away from that. The other thing too as well is I try to make sure I have a lot of like veggies in the diet, lean meats, olive oil, fish oil, those things. Definitely try to consume more of those things. And then exercise. No matter what age you are, no matter what level you are, it doesn't mean that you got to go in there and start lifting weights like you're, John Cena or Arnold Schwarzenegger or whatever, right? But at least you start getting some physical activity. Muscle is really important, especially when you're getting older too as well, because you start losing a lot faster. And if you're just sitting around, you're not doing anything, it's going to go a lot faster. You got to constantly stimulate that. And also, just building muscle in and of itself will allow your cell health to get better, and you're going to process everything a lot better too as well. So physical activity, very, very big. And I always impress that upon anybody, even if they've had surgeries or knee replacements or whatever else they've gotten replaced.
Yeah, and then you're gonna sleep better. And
Absolutely.
it's a little
Sleep is good.
cycle. Yes. And it always just gets me because like I can talk to just like this high level expert like you, and it's still these basics that we try to overcomplicate so many times. You're like, oh wait, I need surgery. And it's like, well, but are you honed into your basics, like
Right.
your exercise, your sleep, all the things that we're told to do that are so fundamental and like circadian rhythm. And yet we're willing to neglect those and go for this thing that we're told is the fix. It's wild, isn't it?
It
It's
is.
wild.
It's just the basics. Sometimes fundamentals makes a huge difference.
Yeah. What are you still learning right now? Like, what is opening up for you that you're really fascinated by as you move forward in life and in your practice?
Well, I mean, just even on the regenerative front, now the trend is going more towards dosing of cells, for these
What does that
treatments.
mean? Like,
So,
just
meaning kind of like, for instance, let's just say you had an infection and you got an antibiotic from the pharmacy and it says X number of milligrams,
Mhm.
right? So there's a certain set based on the population that this dosage will work for this. And so what's happening now is there's a lot more research going to, well, how many cells do you need to help with arthritis in the knee? How many cells do you need to help with shoulders from whether it be stem cells or PRP? That's where things are starting to trend ultimately. And I think you're going to see a lot more of that, but it's still a little bit more underground to a certain extent. But that's something that also I'm trying to implement too as well. And that a lot of doctors have been starting to do that too. So I think that's pretty exciting. The other thing that's also exciting as well is how can we create more stem cells in our body, or at least before you get a stem cell treatment, say for instance, increase the number of cells as much as possible. So doing other modalities such as like stuff with the HBOT, oxygen, things with lasers too as well that we're trying to implement too as well. How can we do that so that we can ultimately get the best possible treatment in somebody?
what do you do with lasers?
Well, lasers are different types of lasers that actually can stimulate healing, but it also can help with acute pain too as well at the same time and accelerate the healing process ultimately with somebody.
Oh, kinda like what I would do on my face or something, like if I got a laser treatment on my face like that,
Well, that's maybe a little
or
bit
that's
lower
skin, I
intensity,
guess.
but
Mhm.
for on the cosmetic realm or whatnot, but for pain, it tends to be we call more of like a higher class laser. And the
Mhm.
one that we use in our office is the highest class it could possibly be. So it's probably the only laser on the market really at this point that doesn't actually cut or burn anything. But
Wow.
it stimulates at a couple of different wavelengths, so you can decrease some of the acute inflammation, and then also help with the chronic pain in and of itself. And so we integrate that with our regenerative therapies, because when you do these treatments, there's going to be a little bit of a roller coaster for about 6 to 8 weeks before you really start feeling much better. So that, along with some of the other holistic treatments we do as well, whether it be supplements, dietary changes, and functional movement, can make a huge difference in terms of how somebody feels ultimately.
Wow. Yeah, for sure. Um, if you were giving one piece of advice to somebody who's living with pain right now, what would that be?
I would say watch what you're eating and start moving.
There you go.
Uh-huh.
Like, so simple, right? I know, and even if you're in pain, I know I experienced some foot pain, and it was just, like, really frustrating because it made it really hard to move, like, I wanted to cry a lot, and, it lasted, like, a year, and then it went away, and I think it was due to some weight gain, but it's hard to lose the weight when you're in pain to move, you know? So, I guess then you've really gotta find a practitioner like you and start really getting more serious about taking care of that, right? Or looking
Yeah, I
into
mean,
it further.
there's so many things out there that might be able to help with that, in that
Mhm.
regard without going into all of it. But I mean, some of them by name because they're very popular right now. And honestly, there are even supplements that actually can mimic and do the same exact thing that people don't know about.
Cool.
So you don't necessarily need to have a prescription for one of those medications, which at this point seems to be very hard to get for most people in general.
Well, what are you talking about?
Well, I mean, some of the, you've heard medications like Ozempic and some
Uh-huh.
Galatube, Wegovy, and all those things.
Uh-huh.
I mean, a little bit harder to get nowadays, especially as, compound pharmacies have shut down. And so it's really a little bit harder to
Oh.
get. But sometimes there are supplements that could be utilized where, for instance, just give you example one where it actually helps with insulin resistance.
Yeah.
And so if you actually start calming that down, you're not going to feel quite so hungry anymore at that point. So if you're not moving quite as much, and you're not quite so hungry or whatnot, you're not gonna do the default thing of where, we feel like when you're injured, you don't feel good. And the natural thing is to actually end up eating. So it kind of
Yeah.
quells that down.
Yeah, for sure. Well, what have we missed? Is there anything that we missed or anything that we need to address before we go? Or is there anything that's coming up for you that you'd like to say before we go?
Not that I can think of, but I mean, I really am glad I was able to get on the show today. I mean, I really enjoyed
Me
being with you.
too. What thought would you like to leave everyone with before we sign off?
Well, I would say, look, hey, there is always a way to get rid of your pain. As I mentioned in my book, and that's the title of it, you don't have to stick with drugs or surgeries. There's always a way around it. You just got to dig a little bit and find the right kind of person to help you.
It's really inspiring, and I mean, we all experience it at some point or another, so it's incredibly inspiring, and thank you for all that you do, and just keep expanding and moving forward. I just think that's incredible. How can everybody follow you and maybe even work with you? Can you share that really quick?
Yeah. So, we have our website, at prolhealing.com. And then we're also on Instagram. I mean, we kind of also just rebrand a little bit to Ascend Regenerative. And it did that as a rebrand more so because we wanted to see people just rise up and get better. And that kind of was the motivation behind that. So that's the Instagram handle.
That's a great name. Ascend, absolutely. We do. We want to ascend. We want to rise higher. We want to feel good. And that's really beautiful. And of course, everything is going to be in the show notes so anybody can click through and also get your book, which tells more, dives deeper into your story and everything that we talked about today. I only read a small portion of your book, but I really enjoyed it and it was a really easy read. And I found myself really like, I don't know, wanting to read more. So
Great.
anyway, yeah, thank you so much. I'm so glad you're here today, and I encourage everyone to go follow you and to learn more. So thank you so much.
All right. Thank you.
Okay, y'all. I found that incredibly inspiring. I hope you did too. I'm sitting here with pain in my foot right now. I don't know if you followed my journey in the last few years. I've talked about it on the show a lot. I started experiencing, like, terrible foot pain, and like I was talking about just then with him, it would make me cry. Sometimes in the morning, I couldn't walk, and I was like, "This sucks." Like, you think that rest is going to make it better, and when it doesn't, then you're like, "Holy crap, I'm really in pain." And if resting doesn't help, what do I do? And so it's gotten so much better. I never went to a podiatrist. I worked on my inflammation. I cut out sugar. I slept more. I looked at my hormones. I did all these other things, but I didn't do PRP or stem cells. But I'm considering it because the pain is so much better. I've had times without any, and I lost about 35, 40 pounds. But I I was walking a lot for that. Walking and lifting weights, that's the key in my existence. Like, that's and I was avoiding all of that. I was, like, going to Pilates or whatever else. It's a bunch of BS. I needed to just walk and lift weights, imagine that. And so, I just the other day started experiencing pain in a whole new way in my left foot. And my right knee is the one that hurts. So there could be compensation in there. Who knows? But I'm just like, oh my gosh, how do I manage this? I ordered special shoes. I ordered inserts. I'm like trying to figure out how not to walk differently to compensate because that doesn't seem like a good solution. So for me, hearing this is so inspiring because I want to figure out how to handle these things as I get older. And yeah, we want to be youthful and all this kind of stuff and live our best lives. But our bodies aren't always going to get the memo. Our bodies are going to have things go on that we don't necessarily have full control of. I mean, you heard his story. He was just lifting weights and moved the wrong way. And it's like, oh my gosh, now I'm in pain and now it's lasting years and then you screw it up or whatever with steroid shots and what you're told to do or what we've been told. And now I feel like we're myth busting about a lot of pain management and moving forward in a really positive direction. This is all really good stuff. So, anywho, there's my 2 cents on that, my little soapbox of some sort. So you can definitely figure out ways to tackle pain. And thank you to him for all that he shared. So, okay, thank you so much for being here. I am so honored that you chose to spend your time here on this podcast with me. Always, truly so grateful. Follow the show on Facebook. It's the Amy Edwards Show, or me on Instagram. It's combo, Real Amy Edwards. And I have a TikTok, The Magic Babe, and the Amy Edwards Show on TikTok. So I'm all over the place. AmyEdwards.info, AmyEdwards.com. You can sign up for the newsletter. That's the best way to stay up to date with everything that's happening here and see what strikes your fancy. I do have to say, though, that every episode has these wonderful nuggets of wisdom that just blow me away every single time. So I'm so grateful to get to share those voices and share it with you. So thank you so much for being here. Hair, of course, hair extensions by the Collective ATX, the very best. Look, I did it curly today. I'm like, I had to curl my extensions a little bit, but I have naturally curly hair. And looks good, right? You can't tell this is extensions. Anyway, if you're not watching on video, we have a YouTube channel, so come on over and check it out. Connect with me anytime, reply to the newsletter. I'm always here for it, to hear your feedback. Rate, review the show if you haven't. I would be honored to know what you think. Good, bad, just anything. I love to hear it. It makes me better every time. So thank you so much. You keep shining bright. You're going to be pain-free. And you know what? Or if you're not in pain and you are someday, you're going to remember this conversation. You're going to go, there's a better way. I don't have to get the steroid shot. I don't have to have surgery. I can find a way, and my body is so powerful. It can heal. It's fucking cool as shit, right? I love it. Keep shining bright, you. I love you. Until next time. Thank you so much for being here. Please rate, review, and follow us. And we'd love to hear your feedback. Keep shining bright.